patient of mine came in probably about 3 years ago, and for a regular 6-month checkup, and she was complaining about something that was bothering her, a little sore that she had in her mouth.
I found it with my tongue. It was on the floor of my mouth, and came in and had a regular appointment with Dr. Kaplansky, and then just mentioned to him that I had found a little bit of a lump underneath on the floor of my mouth, and
I took one look at it, and I wasn't sure what it was. I wasn't going to let it go, and so we referred it to an oral surgeon. The oral surgeon, when he looked at it, apparently he told me that he didn't think it was anything too serious. But again, better to be safe than sorry. He sent her to a pathologist, and they biopsied it, and sure enough, squamous cell carcinoma, and it's not a good thing.
I guess it saved my life. Otherwise, I would have not thought anything of it and put it off, and thank goodness I didn't.
I have always done oral cancer screening, and I would depend on a visual examination and a digital examination, palpating for nodes under the chin and under the angle of the jaw, and I still do that. But when we depend only on the visual examination, we miss a lot, unfortunately. There is new technology out now that allows us to see oral cancer lesions before they become visible to the naked eye. It's such an exciting breakthrough because early detection is the key, as it is in all cancers, but especially oral cancer, because oral cancer is a deadly, deadly squamous cell carcinoma, and the survival rate is terrible, worse than prostate cancer, worse than skin cancer, melanomas, and yet if you catch it early, 5-year survival rates are like better than 80 to 90%. So this new technology that we use is a pretty simple device. It looks like a handheld mirror, and it has 3 different colors of light that we use. The white light, a concentrated beam of white light, allows me to see all the tissues very clearly, just to look for obvious masses. We then turn to the violet light, and the violet light is a very interesting wavelength in that when you shine violet light on healthy tissue, what comes back is a fluorescent blue. And so what I'm looking for is that fluorescent blue for all the soft tissues that we're examining. If there's unhealthy tissue, the area will look dark. So it's very simple to pick up. Now, if I do see a suspicious dark area, we then turn to the third light, the green amber light. And this light works on principle of reflectance. And what happens is the blood vessels reflect back this green light, allowing me to see very clear, defined blood vessels. And that gives me a very good idea as to whether it's a malignant or a benign lesion, because malignant lesions have a very diffuse, irregular pattern of blood supply. And so with the help of these 3 wavelengths, I can see a lot more than we were ever able to see before. And if there's anything at all suspicious, we get it biopsied.
The technology is there. We're able to do it. If you find anything, if you think anything, just do it. Don't hesitate.